One of the areas of neurotology and subspecialty is lateral skull-base surgery. So that's taking care of patients with lateral skull-base tumors, the most common being acoustic neuroma or vestibular schwannomas, also meningiomas, epidermoids, and there's some more rare pathologies. But these are tumors that involve the structures of the inner ear, so the hearing nerve, the balance nerve, the facial nerve. And we work in a multidisciplinary fashion with our neurosurgery colleagues in taking care of these patients and basically going over what their options are. And our focus on these patients is taking care of them, being able to preserve facial function and also preserve hearing. And in some cases, that's a very real possibility to preserve facial function, of course, but also preserve hearing and get the tumor addressed in a safe manner. We offer all three treatment options for them. That can be observation with repeat imaging, microsurgical resection, and then stereotactic radiotherapy. From a surgical resection standpoint, we offer all the different approaches from hearing preservation approaches to approaches that sacrifice hearing, and everything's really tailored upon the patients, their overall health, their hearing, the size of the tumor, the location of the tumor, and to a significant degree their preferences and what they would like and what their goals of care are. Traditionally, years and years ago, it had been patients that were diagnosed with an acoustic neuroma were immediately directed towards surgery. Being at an academic center with a multidisciplinary fashion, we're able to offer patients the most up-to-date therapy options for them. And for some patients, that means keeping an eye on things and not having to proceed with surgery. At the same time, we also have the ability to take care of patients that have a tumor that either immediately needs to be addressed with surgical means or radiation, or keep an eye on a tumor, and if it does something that is poor behavior, we're able to address that either surgically or with radiation.